Emergency warning. A deadlier disease than COVID is spreading rapidly. A new virus is spreading rapidly across the world, and scientists are warning that it could soon surpass COVID in terms of its devastating impact. According to research, COVID has claimed the lives of 7 million people worldwide and pushed us into 2 years of lockdown. But this new virus is said to be 50 times more dangerous than COVID, and if awareness is not spread early enough, it could push us into lockdown for a decade, according to the European Society of Clinical Microbiology and Infectious Diseases. Describing this new virus, they said that while COVID affected only humans significantly for now, 3 years later, it has only affected 10 species. But this new virus has already affected about 90 bird species and nearly 48 mammal species, making it viral across various species. World Health Organization also issued a warning about this virus. If it's not taken seriously today, it could spread the worst pandemic of this century because viruses like these start spreading slowly at first as they evolve their structure and then suddenly escalate into an exponential spread. Let's understand this virus deeply to save our lives and our family. The virus I'm talking about is called the Influenza A virus, and specifically, its H5N1 strain. If you look at the history of these Influenza A viruses, even up to 2024, you'll see that despite all the global pandemics, including COVID, they've totaled only 12. But can you believe it? 5 of these were caused solely by different strains of this Influenza A virus. Now, here comes a new powerful strain, H5N1, even more dangerous than before. You know what's even scarier? This H5N1 is showing the same infection pattern as seen in all major pandemics in history, especially with COVID and the notorious Spanish flu. Once it learns to bypass our immune systems and hits its tipping point, where infections skyrocket suddenly, it'll be too late to contain it. This is similar to what happened with COVID-19, and this virus doesn't understand mercy or preparedness. How is a virus able to bypass our immune system? Now, what's the science behind it? How does the virus suddenly learn to bypass the immune systems of its hosts and start spreading exponentially? We'll understand it better as we delve into the host adaptability of H5N1, which means its ability to affect multiple species. Currently, just understand this much: the COVID that spread, that too changed due to this tipping point. In November 2019, it came before the world, and from November to March, it kept incubating in many people, and then in March, its tipping point came, after which it went out of control. Countries around the world have reported more than 1 million coronavirus cases. The death toll is now worse than the Spanish flu. It's a rapidly emerging situation and honestly concerning. Regarding H5N1, the way news is coming from all over the world, the tipping point for H5N1 may be now approaching. We may have only a few years, or even just a few months, left to respond. Besides, this H5N1 virus, although an influenza virus that commonly causes bird flu, is entirely different from any bird flu virus seen before. If you want to know full detail how this virus is going to bypass our immune system, read our article. Check the link in the description.